with an Israeli study that had 2.5 million patients and found that the vaccinated group was actually 7 times more likely to get infected with COVID than the people who had gotten COVID naturally?
Senator, I'd have to get back to you on that one. I'm not familiar with that study.
Well, you think you might want to be if you're going to travel the country insulting the millions of Americans, including NBA star Jonathan Isaac, who have had COVID, recovered, look at a study with 2.5 million people and say, well, you know what, it looks like my immunity is as good as a vaccine or not, and in a free country, maybe I ought to be able to make that decision. Instead, you've chosen to travel the country calling people like Jonathan Isaac and others, myself included, flat earthers. We find that very insulting, goes against the science. Are you a doctor or a medical doctor?
I've worked over 30 years on health policy.
You're not a medical doctor. Do you have a science degree? And yet you travel the country calling people flat earthers who have had COVID, looked at studies of millions of people, and made their own personal decision that their immunity they naturally acquired is sufficient. But you presume somehow to tell over 100 million Americans who have survived COVID that we have no right to determine our own medical care. You alone are on high, and you've made these decisions, a lawyer with no scientific background, no medical degree. This is an arrogance coupled with an authoritarianism that is unseemly and un-American. You, sir, are the one ignoring the science. The vast preponderance of scientific studies, dozens and dozens, show robust, long-lasting immunity after COVID infection. Even the CDC does not recommend measles vaccine if you have measles immunity. The same was true for smallpox. But you ignore history and science to shame the flat earthers, as you call them. You should be ashamed of yourself and apologize to the American people for being dishonest about naturally acquired immunity. You want more people to choose vaccination? So do I. You want to lessen vaccine hesitancy? So do I. You want to have that happen? Quit lying to people about naturally acquired immunity. Quit lording it over people, acting as if these people are deplorable and unwashed. Try persuasion instead of government cudgels. Try humility instead of arrogance. Try freedom instead of coercion. But most of all, try understanding that there's no more basic medical right than deciding what we inject into our bodies. Today, after hearing that millions of people in a study show without a doubt that there's a great deal of immunity from getting it naturally, do you want to apologize to the 100 million Americans who suffered through COVID, survived, have immunity, and yet you want to hold them down and vaccinate them? Do you want to apologize for calling those people flat earthers?
Senator, I appreciate your question and appreciate that everyone has their opinion. We follow the facts and the science at HHS. We use the expertise of the medical professionals, the scientists at HHS to make decisions. It's a team effort, and we rely on what is on the ground showing us results.
Except for the dozens and dozens of studies. In fact, most, if not all of the studies show robust immunity from getting the disease naturally. The CDC says if you've had measles and have immunity, you don't have to be vaccinated. The same was true of smallpox. You're selectively doing this because you want us to submit to your will. You have no scientific background, no scientific degrees, and yet you aren't really concerned about 100 million Americans who had the disease. You just want to tell us, do as you're told. That's what you're telling us. You want to mandate this on all of us. You're going to tell us if I have 100 employees, you're going to put me out of business with a $700,000 fine if I don't obey what you think is a science. Don't you understand that it's presumptuous for you to be in charge of all the science? Have you ever heard of a second opinion? I can't go to my doctor and ask my doctor's opinion. I mean, this is incredibly arrogant, combined with this authoritarian nature that you think, well, we'll just tell all of America to do what I say, and they better, or we'll fine them, or put them in jail, or not let them go to school, or not let them travel. The science is against you on this. The science is clear. Naturally acquired immunity is as good as a vaccine. The Israel study actually showing it better. This isn't an argument against the vaccine, but it's an argument for letting people make a decision who already have immunity. You're not willing to consider natural immunity?
Senator, our team has reviewed every study that's out there on COVID, whether it's from Israel, from the U.S., or wherever else. They have used the facts that have been provided through the rigorous research that's been done to reach a conclusion. 660,000 Americans and more have died because of COVID. We're trying to do everything we can to save as many as possible. We're using the facts, we're following the science, and following the law.
Nobody's arguing the severity of this, but you are completely ignoring the science on natural immunity. So's Fauci, so's the whole group. You're just ignoring it because you want submission. You want everybody just to submit to your will, do as you're told, despite the evidence, the large body of scientific evidence that says naturally acquired immunity does work, is an important part of how we're all going to recover from this. So's the vaccine. But when you add them together, we're at a much different place than if you ignore them. 100 million Americans, by conservative CDC estimates, have had the disease. 200 million or more now have been vaccinated. It's a good thing. Combined together, it's how the disease is. Nobody wants to get the disease. We're not advising anybody to get the disease. But if you were unlucky enough to get it, think of the nurses and doctors and orderlies who all bravely took care of COVID patients. There was no vaccine for a year and a half. They took care of people, risked their lives. They got it, survived, and now people like you are arrogant enough to say you can no longer work in the hospital because you've already had the disease. We're going to force you to take a vaccine that the science does not prove is better than naturally acquired. That's an arrogance that should be chastened.
Dr. Fauci, the government recommends everybody take a booster over age 5. Are you aware of any studies that show reduction in hospitalization or death for children who take a booster?
Right now, there's not enough data that has been accumulated, Senator Paul, to indicate that that's the case. I believe that the recommendation that was made was based on the assumption that if you look at the morbidity and mortality of children within each of the age groups, 0 to 5, 5 to 11.
Right. So there are no studies, and Americans should all know this. There are no studies on children showing a reduction in hospitalization or death with taking a booster. The only studies that were permitted, the only studies that were presented were antibody studies. So they say if we give you a booster, you make antibodies. Now, a lot of scientists would question whether or not that's proof of efficacy of a vaccine. If I give you 10, or if I give a patient 10 mRNA vaccines and they make protein each time, or they make antibody each time, is that proof that we should give 10 boosters, Dr. Fauci?
No, I think that is somewhat of an absurd exaggeration.
Well, that is the proof that you use. Your committees use that. That's the only proof you have to tell children to take a booster is that they make antibodies. So it's not an absurdity. You're already at like 5 boosters for people. You've had, 2 or 3 boosters. It's like, where is the proof? Now, I think there is probably some indication for older folks that have some risk factors. For younger folks, there's not. But here's the other thing. There are some risk factors for the vaccine. So the risk of myocarditis with a second dose for adolescent boys 12 to 24 is about 80 in a million. This is both from the CDC and from the Israeli study. It's also in the VAERS study, remarkably similar for boys, much higher from boys than girls and much higher than the background. The background's about 2 per million. So there is risk and there are risks. And you're telling everybody in America just blindly go out there because we made antibodies. So it is not an absurd corollary to say if you have 10. In fact, you probably make antibodies if you get 100 boosters. All right? That's not science. That's conjecture. And we should not be making public policy on it.
So, Senator Paul, if I might respond to that, we just heard in his opening statement Ranking Member Burr talk about his staff who went to Israel. And if you look at the data from Israel, the boosts, both the 3rd shot boost and the 4th shot boost, was associated with a clear-cut clinical effect, mostly in elderly people, but also as they gathered more data, even in people in the 40s and the 50s. So there is clinical data.
But not in children.
Well,
see, again, here's the thing is you're not willing to be honest with the American people. So, for example, 75% of kids have had the disease. Why is the CDC not including this in the data? You can ask the question. You can do laboratory tests to find out who's had it and who hasn't had the disease. What is the incidence of hospitalization and death for children who've been infected with COVID, subsequently going to the hospital or dying? What is the possibility if your kid has had COVID, which is 75% of the country's had COVID, what is the chance that my child's going to the hospital or dying?
If you look at the number of deaths in pediatrics, Senator, you can see that there are more deaths
Of
in
people who have had it,
pediatrics-
of people who have had the
pediatric-
disease.
Senator, we also know from other studies that the optimal degree of protection when you get infection is to get vaccinated after infection. And in fact, showing reinfection in the era of Omicron and the sublineages, that vaccination.
But you can't
follows.
answer the question I asked. The question I ask is how many kids are dying and how many kids are going to the hospital who've already had COVID? The answer may be 0, but you're not even giving us the data because you have so much wanted to protect everybody from all the data because we're not smart enough to look at the data. When you released data earlier, when the CDC released the data, they left out the category of 18 to 49 on whether or not there was a health benefit for adults 18 to 49. Why was it left out? When critics finally complained, it was finally included because there was no health benefit from taking a booster between the 18 to 49 and the CDC study. Another question for you. The NIH continues to refuse to voluntarily divulge the names of scientists who receive royalties and from which companies. Over the period of time from 2010 to 2016, 27,000 royalty payments were paid to 1,800 NIH employees. We know that, not because you told us, but because we forced you to tell us through the Freedom of Information Act. Over $193 million was given to these 1,800 employees. Can you tell me that you have not received a royalty from any entity that you ever oversaw the distribution of money in research grants?
Well, first of all, let's talk about royalties.
That's the question. No, that's the question. Have you ever
no,
overseen,
Senator,
have you ever received a royalty
playing-
payment from a company that you later oversaw money going to that company?
You know, I don't know as a fact, but I doubt it.
Well, here's the thing is, why don't you let us know? Why don't you reveal how much you've gotten and from what entities? The NIH
Okay,
refuses.
Senator.
Look, we ask them. The NIH, we ask them whether or not, who got it and how much. They refuse to tell us. They sent it redacted. Here's what I want to know. It's not just about you. Everybody on the vaccine committee, have any of them ever received money from the people who make vaccines? Can you tell me that? Can you tell me if anybody
Senator,
on the vaccine approval committees ever received any money
Are you
from
going to
people
let me
who make
answer
the
a
vaccines?
question? Soundbite number one, are you going to let me answer a question? Okay, so let me give you some information. First of all, according to the regulations, people who receive royalties are not required to divulge them even on their financial statement, according to the Bayh-Dole Act. So let me give you some example. From 2015 to 2020, the only royalties I have was my lab and I made a monoclonal antibody for use in vitro reagent that had nothing to do in patients. And during that period of time, my royalties ranged from $21 a year to $700 a year, and the average per year was $191.46.
It's all
Get that,
redacted, and you can't get any information on the 1,800
Senator Paul,
scientists.
your time is
So
long.
we want to know whether
Senator
or not
Paul.
people got money from the people who made the manufacturing.
Senator Paul,
vaccine.
your time is long over expired. I gave you an additional 2.5 minutes. The witness has responded. We are going to move on. Senator Sanders.